Well, I think with vaccinations, it's important to remember a few things. Number one, there are a lot of different vaccinations out there, and what we in the American Academy of Pediatrics recommend is not every vaccine out there. And I think a lot of people, a lot of myths around vaccines tend to center around this notion that just because a vaccine exists, we're recommending it. And that's not true. We have decided on the schedule for a reason. Number one, we want to know when vaccines are safe to give. And so that's a big part of the consideration. So a lot of people also have concerns about getting a lot of vaccinations when babies are very young, and the first 2 years of life is when you get most of those vaccinations. The timing around those vaccines has been studied extensively, and we know that it's safe to give what we give when we give. And it's also safe to give the number of vaccines we give at a time at those particular intervals. And so that's another concern that a lot of people kind of bring up, that is it okay to give 5 or 6 vaccinations at one time? The answer is yes, and the schedule itself has also been looked at extensively in very large studies that have shown that there's no risk or harm to the baby or any patient with giving a lot of vaccines at once. So safety is an important consideration. Number two, we want to know, when is a child most likely to be affected by a particular disease? So we don't give all vaccines right at first. We give some vaccines a little bit later as they get older, some in adolescence, and because we're trying to give the vaccines not just when they're safe, but to prepare them for when they're most likely to be exposed to them. And then there's also a public health perspective on this, right? We all live in a society where we interact with people on a daily basis. We go to school, we go to the grocery store, we go to playgroups, and so we, I think, as a society, need to be mindful of the risks we're putting others at. We give them when we give them for a reason. We feel confident in the safety of those vaccines. You know, we trust in the process of vaccination.